Hey guys, this is Alex from Salmonella Place. Today I'm going to give you a short tutorial on tooth decay. And I'm just going to explain for those of you who perhaps aren't medical students or at least not dental students, what it is. And if you are a medical student, I'm going to explain to you why it's really important if you do get a patient and you notice that something's not right in their mouth, why you should advise them to visit a dentist. So firstly, why are your teeth important? Okay, so you use your teeth to bite, grind, and chew your food, so it becomes a food bolus, which is like a lubricated ball of food, so you can swallow it so it can be digested in your stomach. So without your teeth, you're not effectively able to start the digestion process, and this can cause discomfort in swallowing and pain in the stomach. Secondly, your teeth are used in phonetics and speaking, so you won't be able to pronounce words or enunciate them in the correct way if you don't have your teeth. And thirdly, and most importantly, is aesthetics. So if you want to smile and, have a pleasant smile, then you need your teeth. Now I'm going to explain to you. On the left-hand side of this slide, you can see a tooth. So on the top half, you have the crown of the tooth. And I'm just pointing right now to the junction between the crown, which is actually visible in the mouth, and the roots, which are not visible, and they are stuck in our jawbones. So the crown is the part that, unfortunately, if you don't take care of your teeth, can get decayed. And I'm going to draw a couple of little black dots so you can see where decay would be and what would it look like. So if you just check this out right now. Now, the outer layer of the clinical crown is called enamel. It's covered with this enamel, and it's a very hard substance. But a couple of millimeters inside the enamel is the dentin. This is a lot softer, and it's a lot easier once the bacteria has got through the enamel to spread very quickly in the dentin. And then finally, in the inside of the tooth, the very inside where the nerves and blood vessels run, that is called the pulp. That is extremely soft. And once the decay has reached there, then after treatment, the tooth will not be vital. That means that you have to have a root canal treatment, and that is taking out the pulp so there won't be nerves or blood flow to that tooth. That doesn't mean that you have to extract the tooth or get rid of it. It just means that it won't have any feeling. Now, what is tooth decay or caries or a cavity? Tooth decay means that the enamel or dentin or pulp layers that I just explained get infected and they start to break down. That's exactly what caries means. It means the crumbling of the dental substances. And a cavity is what can sometimes, not always, because sometimes the structure holds even though it's decayed, but a cavity is when the tooth structures collapse upon themselves and you have a hole in your tooth. So if you see that you have one of these, you can't always see them, so you need to regularly go to your dentist. I recommend a 6 months checkup, maximum a year. But if you do notice perhaps on your lower jaw it's more visible, you can see some black or yellow or brown discoloration in your teeth, go to your dentist and one of the following things will happen. Either you will receive a filling. That's where the dentist drills away the decayed tooth structures and then fills it with usually a white looking substance, which is pretty much the same color as the tooth. Or if it has penetrated deeper, then you might have to have a root canal, which is, like I said before, removing the pulp and the blood supply and the nerve supply. That is a more invasive procedure, but at the end of it, your tooth will be fine and you'll be able to use it as normal. The last thing that could happen if you have waited too long, is that the tooth may need to be extracted. So if you do have any pain or you see any discoloration or any kind of symptoms, bad breath, anything like that, then you really need to go to your dentist ASAP. Now, the most important thing is how to prevent tooth decay. Firstly, it hasn't been proven, but some people do have a disposition to plaque retention, which is, plaque or tartar. The plaque is the soft one, and tartar is actually like a hard stone that sticks to your teeth. The plaque is the beginning of the accumulation of the bacteria. Now, that can be due to crowding when your teeth are all on top of each other. And that, how the teeth come out can sometimes be genetically determined. But if you do have that problem, just do what I say now, and you have to be extra careful. Firstly, you should brush, ideally, after every time you eat. But however, if you're at work or, you don't have a toothbrush on you for some reason, chewing gum can help lessen the plaque retention. Another important thing is when you're actually brushing, make sure you try and get as many surfaces as possible. A lot of people tend to brush back and forth just on the anterior teeth or the front teeth, and they forget to do the insides, at the back, especially if you're young and you have erupting teeth. They are much more susceptible to decay because they're not fully calcified. So try to brush all the way around. And I will do another tutorial on toothbrushing techniques at a later date. And I will also go into more detail on the treatments of caries as well. Also, flossing is a very important thing as well. You should do it every couple of days, not every time you brush, because you don't want to damage the gingiva, which is between your teeth. That's the soft skin or mucosa that is between each tooth. You don't want to damage that, but you do want to make sure that there is no food stuck in between the teeth or debris. So if you feel that something stuck there, of course you should floss. Otherwise, do it every 2 days. Mouthwashes can also help as well, but still they do not substitute toothbrushing. Finally, like I said, go for regular checkups. If you are prone to plaque and tartar accumulation, visit your dental hygienist or your dentist even more regularly. Just ask them how often they think you should come. And finally, diet does play a role in the long term in teeth. So if you eat a lot of sugary snacks, a lot of carbohydrates, a lot of acidic, especially acidic foods, because they do damage the enamel, then of course you're going to be more prone to tooth decay. However, there is no reason why you cannot live into very old age without keeping all of your teeth completely healthy. So please take care of them. At the end of the day, it's a lot cheaper to have all of your teeth, because dental reconstruction can be very expensive. And also, it's a lot healthier in general because even with the construction, they do have a limited amount of years that they can be in the mouth. So if you have all your teeth, you're going to be more confident, you're going to have a beautiful smile, and that's what everyone should have at the end of the day, a smile. So thanks. If you have any questions, please leave them below this video. And I'll get back to you as soon as I can.